Good evening, ladies and gentlemen, and congratulations to the winners, the participants, and all those associated with the Prix Galien. And a special congratulations and honor to Roy Vagelos for his great vision and leadership. We're truly honored to be here on behalf of Alexandria at the vanguard and leadership of the life science industry. We've tried to help shape every aspect of our pioneering business plan to impact our mission of advancing human health, nutrition, and enhancing the quality of life. We're pleased to continue our support of the Prix Galien sponsorship, especially on the occasion of the Golden Jubilee, the 50-year anniversary in 2020. We're proud once again to host the Galien at Appella and present a mission-critical panel addressing one of the most pervasive health challenges in our nation's history today, the opioid crisis. Looking back to my remarks in 2019, 2 years ago, the pharmaceutical industry had unseated government as America's most hated industry, ranking last on a list of 25 industries that Gallup survey annually polled. Now, the life science industry, due to COVID, has really emerged as the industry that has helped save the planet, and a dramatic new change in the people's view of the industry has emerged. During these past 18 months, we've been through one of the most profound global public health crises in a century, resulting in economic lockdown and millions of casualties from the pandemic. Almost overnight, the public's view of this industry has changed from one of scorn to one of being the savior of humanity. And we have moved from a pandemic to an endemic. And hopefully millions of lives will have been saved globally with vaccines, therapeutics, and diagnostics. Seeing the positive public appreciation and strong bipartisan support for essential research and development, which has persisted and really been evidenced throughout this pandemic. The pandemic really brought to light two fundamental truths for the biomedical industry. One is the repatriation of critical biomedical supply chains, and the other is the future of medicine is really one of complex next-gen medicines which need to be produced in addition to be discovered here in the United States. And the landscape is full of more promise for patients and health at large. The biomedical industry is truly one of the most innovative and crown jewel industries of our society, and it's important we preserve and protect it. Right now, before Congress, H.R. 3, the budget-busting spending bill that is being proposed, contains some very draconian implications for the R&D industry, and it's been said by many of the pharma companies that they would slash R&D budgets 40 to 50% if this was to pass. So it's in all of our best interests to try to refocus on supporting innovation, not hindering innovation. We must be focused on the critical need of sustaining an environment that it encourages biomedical innovation and drives policy and rewards investment in disruptive scientific advances that will benefit patients and improve human health. Shifting to another tremendous crisis we've seen over the last many years is the opioid crisis, which now has impacted this country in a way like no other scourge in recent memory. Overdoses claimed 96,000 American lives during the 12 months ended in 2021, an estimated 30% increase in deaths since March 2020, really unheard of. And we don't see a huge amount of public action, and we don't see it in the press every day. It would be like having a Vietnam War and a half impacting the United States each and every year, but unseen and unheard. We at Alexandria joined forces with Google's subsidiary Verily in 2017 to launch 115. 115 was the number of deaths, opioid deaths, in that year per day here in the United States, and it's only increased since that time. We located in Dayton, Ohio, because Dayton had the highest per capita death rate of any city in the United States. 115 is a truly one-of-a-kind, innovative, data-driven, nonprofit, evidence-based healthcare ecosystem with a full continuum of care, the only one that really exists, from detoxification, which is required and provided by many, but then it goes on in the campus to provide sober living, family reunification, job training, and job placement. The first one-of-a-kind, full continuum of care. With our 115 partners, we are unwavering in our commitment to help people recover from opioid addiction and live healthier lives while revitalizing our communities. Being good to people is good for business as well in those communities, and we'd like to see this model replicated across the country. We need to change public perception of the mental health and opioid crises. Addiction goes along with mental health, and about 50% of people who are struggling with mental illness, in fact, suffer some form of addiction. These are issues that don't get better when they're ignored, and they're by and large being ignored by society in a big way. Our nation must further increase in a dramatic way its support and funding around the deadly and costly opioid addiction crisis. We must all work together to solve one of the worst drug crises in the country's history. We're putting out a call for innovative and new funding mechanisms, and we hope that 115 will become a model that will be pervasive not only in Ohio but across the country. The life science industry has demonstrated that it can radically and positively impact society, and it's imperative we all work together to actively support, incentivize, and innovate in a way that impacts human health in a positive fashion. Thank you very much.